Free State now, where we find my colleague Mangoba Mchunu in Bloemfontein. Also there, I'm sure, Mangoba, there's a lot of relief about the resumption come Wednesday of this phase of the Johnson & Johnson vaccine, particularly because last week we heard from the National Institute of Communicable Diseases that the Free State, the Northern Cape and the Northwest had been seeing a bit of a surge. And I interviewed on Friday the MEC for Health, Metsiu of the Free State, who confirmed. So now the next phase is coming. I'm sure they're relieved.
Indeed, Praten, given the fact that, as you've mentioned, there have been quite a number of concerns with the upsurge in the number of cases of COVID-19, more particularly here in the Free State. We do know that in the last 24-hour cycle, there's been over 230 new cases, which is the second highest after Gauteng in terms of those new infections. And officials here are quite concerned at those new cases of coronavirus. Of course, they'll want to ensure that they vaccinate as many people as they can in this second phase of the vaccination program. But we have been speaking to some of the senior citizens here in Bloemfontein, of course, who are quite concerned at the fact that they still don't know where to register and how to go about to register for this particular phase of vaccination. But to get more answers, perhaps, and clarity on the steps that they need to take, I'm now joined by Dr. Sebe Mukwena, who is the provincial head of COVID outbreak and surveillance here in the province. Thank you so much for your time, Doctor. Let's start here. What are we looking at in terms of numbers of over 60s that have registered so far, and what's your target?
Currently, in terms of the number of people who have registered, in terms of those over 60, we are just looking at over 12,000 people who have already registered in the province. And as a province, we have already taken a measure in terms of increasing the numbers, developing different kiosks in different areas where we'll have. But we are also engaging our counterparts in terms of SASSA to make sure that we use their communication, but also use their SASSA points to try to register as many of our elderly people as possible. So as a province, we have a plan in place that we are just going to implement in making sure that we increase the numbers of people who have registered. I'm sure you would know that as a province, we are seeing quite a number of rural areas where we realize that we need to focus more on, particularly in that area of Malutiapofung, we're looking at Fezileda, we're looking at Lejoliputso. So our healthcare workers are on the ground, and soon those kiosks will be announced for everybody to avail themselves. But we must also just remind our people that we have already made it that those who could not register before, they could also be registered at the sites when we start with the vaccinations. There will be stations that will be there with the healthcare workers that will be able to assist our elderly to register.
Okay, because one of the issues that we've, uncovered when we spoke to some of the people is the fact that many of them still don't have information as to where they can go, how to register. So what are you doing in terms of awareness campaign for these senior citizens and bringing the message to them that they can actually register?
Yeah, as I said, as a department, we are engaging our counterparts in terms of SASSA to make sure that we address our elderly at the places where we know they are accessible. And we are going to be using the SASSA pay points. We are going to be using different areas where we know that the elderly people gather or where we will be able to find them. But also, as we said, as the department will be investing or making sure that we establish different kiosks as the time and the date approaches, where we'll be able to invite our people through different media platforms that we already developed. And I must just add that we have been on different media platforms in terms of encouraging our people to make sure that they register, but still also calling on our young people to make sure that they assist their parents, their uncles, their aunts, elderly, to make sure that they register, because we know that a process just needs somebody who is a bit technologically probably savvy or so. So we really depend on our people to take responsibility to assist us. But we are not just sitting back as a department. As I said, there are plans that are in place in making sure that we address this gap of making sure that more people are registering.
And the province, in terms of COVID-19 numbers, we've seen an upsurge in this particular province. Are you concerned, and what's the battle plan going forward?
We are obviously very concerned as a province that the numbers are rising, and we really are worried, particularly of the 3 districts currently. The Mangaung Metro are seeing a rise in cases, and particularly among what you call family clusters. A lot of people gather in huge numbers with no regard of the measures from non-pharmacological interventions, and that is extremely worrying. And I must just say say that when we analyze our data in the last 2 weeks or so, we realized that the non-compliance is more on your townships and locations rather than on your uptown. People only wear masks when they go to town and so on, but when they are at home and so on, they are not wearing masks. Tabamfutsanyane is our huge concern, and particularly the Kwakwa area. And in Kwakwa particularly, we are looking at Futadichaba, we are looking at Makwani. We have seen the rise in terms of number of cases. Also, Buhlokong, as a location itself, it has seen the highest number of cases in the previous week in that district. So we are really worried. There's a sort of area, especially areas that are aligned to the borders. We are seeing also an increase in number of cases. Obviously, in Lady Brand, we saw also a surge in number of cases, and particularly among schools. We are really requesting our people, please let's make sure that we adhere to the measures.
Okay, thank you very much. That's Dr. Semi Mukwena, who speaks on behalf of the Department of Health here in the province. As he says that plans are afoot to try and reach out to as many of those senior citizens here. In fact, Bratien, we are here at one of those centers that has been earmarked for those senior citizens to come and register here at this particular hospital, at Pelenomi Tertiary Hospital here in this particular area. So there are plans to actually reach out to as many of them, the department says.
Yeah, and I guess the key message coming out from that doctor is that while the vaccination rollout is coming, we must still observe the COVID-19 protocols, the restrictions, and behave accordingly, physical distancing, washing our hands, and like you and Lethiwe are wearing their masks, of course, we need to be wearing our masks all the time. Thank you very much. Heidi Jokos in the newsroom in Johannesburg, Lethiwe Mdluli, Ekanana Old Age Home, eThekwini, and to Mangoba Mkhunu there at that Pelenomi Tertiary Hospital in Bloemfontein.